Are you able
सर
to
आप
hear me?
म्यूट पे हैं.
Achha.
You Kosip, Assalamualaikum, you okay?
Yeah, I'm fine, thanks. How are you?
Fine, Kosip, all is good, all is well. So it says we'll be live in next, I think, we already live? Fabulous. So I can't see any viewers here. Okay, no, and I can't see anyone here right now. So Jubair, are you there?
I am there.
Fabulous, 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 wonderful. So we can have, shall we start, Kosip, what do you think? Shall we start?
Start. Yes, start, inshallah.
Start, okay. Bismillah ar-Rahman ar-Rahim. So in the name of Allah, who's more merciful and gracious. So today's our discussion will be on another interesting topic, this type 2 diabetes reversal program. So with me today, I have Dr. Namrata, my colleague, then my respected board member, Mr. Kaushatai, with me, and we have three clients rather, who are like our diabetic reverts already. And Ramya ji is there with us, Shadab is there with us, then we have Asra ji at the same time, where we already help them reverse their conditions, metabolic issues. So today, our topic is very interesting, which is a global epidemic where people are suffering with this in almost every country and almost every house. They have this metabolic issue globally. So today, let me just introduce myself. So I'm Dr. Abdul Muttalib Khan. Actually, I'm MBBS medical graduate from India, and here in UK pursuing diploma in dermatology from ISCP, Ireland, Royal College of Physicians. And with me, Dr. Namrata is there. She's a doctor from India, and she's a registered medical doctor practitioner from India, and she did her BNYS, that is Bachelor's in Naturopathy and Yogic Sciences. That's a registered university in India, and she's one of our members there. She's one of the colleague in my team today. And we have Mr. Kaushatai. Kaushatai is a well-known man, mashallah. He do a lot of lectures on leaderships, on Islamic perspectives of different ailments. So today he'll be talking about mental health and linked to metabolic issues, and how we can easily mitigate the stress, which is again a common epidemic we can see on the global level. So can we start, Juwaria? Let's share. Can you take me to the next slide, please? Does people receive this link already, Juwaria?
Sorry, sir?
Yeah, does people already receive this link?
Yes.
Okay, fabulous. Okay, so our overview. So welcome to the comprehensive explanation of type 2 diabetes reversal. How we can achieve reversal. So today, this is the agenda. I'll take you to the overview of the agenda, the roadmap. So I will start with the introduction to type 2 diabetes epidemics and statistics. I'll talk a little bit about root causes, metabolic and lifestyle drivers. Then Dr. Namrata is there. She'll talk about dietary strategies, evidence-based targeted nutrition interventions, and at the same time, she'll talk about how naturally we can do few things like exercises and all that. Like 3 S's also she'll cover 3 S's at the same time. Then Mr. Kaushatai will talk about mental health and stress, which is again a big topic, which is linked to metabolic issues. So next slide, please. So what is type 2 diabetes? Type 2 diabetes per se is not a disease. We need to understand that. It is one of the symptom of a metabolic syndrome, of a very bigger issue. That is a metabolic syndrome, right? So it is just not a disease. We have to understand, if we understand type 2 diabetes in its root form, why and how and why people are developing type 2 diabetes, right? If we understand that, the root causes, then the development, the gradual development of this type 2 diabetes, I can't see the slides, one second. Yeah. So we're talking about today the chronic metabolic disorder. We'll talk about the root causes of that. Then we can talk about how it develops gradually, right? Gradually how it develops, unlike type 1 diabetes, which can occur suddenly. You can present directly with diabetic ketoacidosis in the hospitals. I have actually diagnosed many type 1 diabetes patients when I was working in any one of the hospitals in India. and they usually come with sudden onset, unlike type 2 diabetes, which is always gradual, and we can easily prevent type 2 diabetes from going from bad to worse. But unfortunately, what we currently seeing is, in spite of medication, in spite of putting people on medication, that their issues still persist. Why then they have to add another medication? Why they have to add third medication? We're going to discuss everything today. Okay. Then there's a link of lifestyle and diabetes. Like, diet is another thing, exercise is another thing, right? And the body compositions, how these things will affect diabetes and metabolic issues, right? And how it is indirect from type 1 diabetes. Next slide, please. Okay, how this disease have become an epidemic. If you see in a single generation, if you see from 1980, in a single generation, it has quadrupled globally. And it has become a 21st century plague. Why? This dramatic rise is why? Because it is directly because of the dietary recommendations, which was 1977 dietary recommendations, which was by American Diabetic Association. What happened in the dietary recommendations? What happened in the food pyramid? What suggestions actually has prompted us to see this global epidemic of type 2 diabetes? So what happened when these things happen, when this dramatic rise, you're seeing that it has been directly coinciding with the shifts in dietary recommendations. And food production practices also changed globally. Like, people started focusing more on cereals, pastas, and all those things. Cereals, so what is happening with this? When we see this, one second, Juveria, somebody's trying to join actually. Just please check that, please. And this ancient disease, if you see that actually diabetes is being reported in Ayurveda almost 5,000 years back. Metabolic health be recorded by Prophet Muhammad almost 1400 years back, right? And these were their very ancient diseases. But what happened just in a span of one generation, that we have seen the quadruple rise of type 2 diabetes epidemic globally. So we'll understand a little bit more when we understand the food pyramid. What prompted to? So let's take me to the next slide, please. So these are the 1980 dietary guidelines. So what happened? What they did is they have actually pushed, people were having at least those time people were having 40-50% of carbohydrates in their regular diets in 1950s and 1970s and 70s basically. And what happened during the dietary guidelines shift? They have pushed. They're saying it is okay to have carbs of 55 to 60% in total diet. And what they did, they said, and they made the culprit fat as the culprits. Because what happened during those days, people were falling sick, people started developing heart attacks after 1950s, and although people understand what could be the reason. And they said it's diabetes, definitely. Diabetes is one of the reasons behind that. So they have they made that fat, the saturated fat, which we have lived for almost 10,000 years, and dependent on these saturated healthy fats, they started blaming those fats. They started saying the avocados are not good. They started saying eggs are not good. They started saturated meats are not good, like the butter, cheese. They all started blaming all this, anything fat-related, cholesterol-related food products. They said they're bad. And what happened? They have reduced. They said reduce the fat consumption from 40% to 30%. What they did? Carbs, they increased it, and fats, good healthy fats, they reduced it. Okay. And what happened? Then we find that breads, pastas, and potatoes form the base of the pyramid, which they have recommended on daily consumption. So this dramatic shift of nutritional guidance represented a fundamental defect in the food habits of the people and the food manufacturers and food producing agencies. And what we are seeing, the impact is there on the global rise of epidemic of type 2 diabetes and many metabolic disorders like fatty livers. So before 1980, there were rare fatty livers were only found in people who are having alcoholics, people who are alcoholics. But when 1980s, After 90 dietary guideline, people eating a lot of carbs. It is the carbs which goes and converts into fat. It's not the fat which goes and converts into fat. Remember that. So majorly the carbs are the defect here. So we need to understand, if you want to reverse this situation, we need to understand three basic things of the food, which Dr. Namrata will discuss on that. That is carbohydrates, proteins, and fat. If you understand three basic things of food, then we can understand that we can easily control and prevent from being a victim of metabolic syndrome. Next slide, please. So what happened here in the diabetic epidemic? So a direct consequence of 1980 guideline, we see gradual rise and epidemic of these diseases, and we are seeing it is almost, as I said, it has quadrupled in just one generation, right? And it has not left anyone affected. Every demographics were affected, both the sexes were affected, all different races were affected, all ethnic backgrounds were affected, all different class of people were affected, even poor people, rich people, everyone were affected. So it has actually affected everyone on the global level. And today it says like 1 out of 9% is having diabetes. And unfortunately, 1 in every 9 seconds is dying because of the complication of diabetes or complication of metabolic issues. Next slide, please. Yes, so from 108 million to 589 million, one in just how many years? Just in 44 years. That's it. In 44 years, you see that today. And this projection, and they're projecting that it will be almost 1 in 8 adults by 2050. And current, the health expenditure, all the governments are spending is exorbitant, which is for the disease, which is easily preventable, a disease which can be easily reversed just by changing the lifestyle. But on these kind of diseases, government is spending huge money, unfortunately, right? They're spending in trillions. In the US, their annual expenditure is almost $1 trillion. The next slide, please. Yes, so this is the iceberg. What is happening, as I said, below the iceberg, right? Here, the deep level of the iceberg, like hidden. What is hidden? The generational consequences. As I said, it is affecting all the generations, right? And there's a big burden on the health strain, right? And which is visible? That visible is, it is now seeing in the younger ages as well. If you see it, younger ages, like, for example, we have some very young client, Mr. Shada, with us, who is hardly, when he developed, he was just 30 years. We have some client who's almost, we have helped a client of almost 15 years at the same time, 15 to 18 years at the same time. So people who are younger, we can see, because younger disease, type 1 diabetes were most commonly seen in younger population, right? Now, and type 2 diabetes was seen in the older population, plus 30, 35, 40 years. Now, unfortunately, because of this, too much of carbs, too much of processed food all around us, we are seeing that in the younger ages at the same time, and seeing there's fold-fold increase. There's a fold-fold increase in diabetic incidence of fatty livers. And fatty liver and diabetes, they are both interlinked. Next slide, please. So evaluation of diabetes nutrition guidelines. So if you understand, in 1980, if you just understand this one, 1980s food pyramid, right? And then what happened, 1980 food pyramid? If you see the base of the food pyramid, you see bread, cereals, rice, and pastas here, okay, which is very, very common. And the second thing, next dietary guidelines, 2016 dietary guidelines. In 2016 guidelines, what happened? They did little bit changes, because they saw the whole world is now already in the grip of the epidemic of type 2 diabetes. What they did in 2016, they did some changes there. They said, okay, fine. They removed the restrictions on the dietary fat. Otherwise, they restricted the dietary fat. They said they made it a culprit, as I said. By 2016, they changed that. But now, just last 15 days back, a fortnight back, just not even a month, they have changed the version to what we have been trying to promote through our platform. Just recently, in 2026, they said What they said, to make the plate, take to the next slide, please. This, yeah, so that's what they have suggested. They said half of the plate. Now, this is what we have been promoting on our platform. This is almost a year to everyone who's joining us, because this what is the lifestyle, one of the lifestyle suggestions what we give to them is about the food, how to portion their plate, at the same time how to portion when they eat the food inside the tummy at the same time. So this two portioning is there. So now they already accepted this fact that almost half of the plate should be vegetables, right? Because before it was all cereals, isn't it? Bread, pastas and all that, right? So now they said half of that has to be non-starchy vegetables. Fabulous. Then quarter plate should be about proteins, and another quarter plate is about fats, good quality of fats. So this is what the plate is. Next slide, please. Yeah, so key to reversing type 2 diabetes lies not in the managing symptoms, but in addressing the root metabolic dysfunction. For that, we need to understand the metabolic issue. We need to understand the metabolic syndrome. So let's take to the next slide. Quickly, we'll see that one now, metabolic syndrome. So this is two different, if you see, let's understand the traditional treatment approaches. Type 1 diabetes, definitely insulin therapy is needed for type 1 diabetes because it's life-saving, because the pancreas are not producing insulin, right? Insulins are produced by the beta cells of the pancreas, and the beta cells are not producing it because they have been destroyed. There's a condition called autoimmune condition where our own antibodies attack our own organs, cells, and because of that, type 1 diabetes, people develop type 1 diabetes because of that issue. And we understand for that one, we require, I think somebody's trying to enter the studio, Juveria. I'm not sure, but is it live?
Yes, it is live, sir, and they have been added to the stage. Like
Okay,
they are in
so
the back
is it? Okay, fabulous. Okay, fabulous. Thank you so much. Okay, so where are we now? Type 1 diabetes and type 2. We understand the traditional treatment approaches, different treatment approaches, type 1 diabetes and type 2 diabetes. Type 1 diabetes, definitely we require insulin there because the pancreatic cells, islet cells of Langerhans, of pancreas, which they produce insulins, are being destroyed and been damaged because of autoimmune attack. And for saying that, and that attack, autoimmune condition, now science says that when the autoimmune attack is very in the initial stages, you can still reverse type 1 diabetes at the same time. In the initial stages, when the attack is live, when it's all, but it's very difficult in type 1 diabetes. When people come, they usually come in diabetic ketoacidosis. When I was working in A&E, I've seen so many diabetic patients, they were not at all aware that they were having diabetes unless they came to the hospital. And we found out with all those symptoms and doing the investigations. And second is, and for that we understand giving insulin is very important, it's life-saving. But you don't require insulin in type 2 diabetes because the problem is hyperinsulinemia. The problem here is, we'll understand it in a bit next slides, we'll understand it, that the problem is the root cause is too much of insulin already got released in the body. So that's the issue. We need to understand, differentiate this very clearly, that the type 1 diabetes is insulin dependent and type 2 is non-insulin dependent. But unfortunately, the current treatments, what they're giving doctors, they put you on one medication, two medication, third medication, and fourth, they put you on insulin. And worsen the situation more. The problem, the basic problem in the body is hyperinsulinemia because of we have eaten so much of carbs in this modern day and age. We have so much of abundance of food all around us, so much of simple carbs and processed foods all around us, okay? When ingesting that, every time we eat that food, what is happening? We are releasing insulin, because what it does when glucose comes in the sugar in the body, right? When we eat sugar, when you eat carbs, simple carbs, it converts into glucose in the body, right? So when we see this high glucose, when the glucose is coming in the blood, so insulin, what is the work of insulin? It has to shift that glucose into the cell. So that cell utilizes that as an energy. Simple. What is happening? It requires insulin to put this amount of sugar inside the cell. Now the sugar is increasing. It needs more insulin. More sugar is coming. It needs more insulin. More sugar is coming in the body because there's the tap, the inlet is open, isn't it? The main problem is the inlet, the sugar, which is taking in the form of the white flour. Any white flour sugar, like there are so many sugar things there, as I just said about the food pyramid. We understand cereals, breads, pastas, and all that. All are sugars only. These are carbs, sugars. So we'll understand what is metabolic syndrome in a bit now. Take me to the next slide, please. Okay, before we understand that, we all know what is type 2 diabetes. We all understand the signs and symptoms of type 2 diabetes. I'll not take much of time here. People do the polyphagia, polydipsia, and polyuria. Polyphagia is poly, too much eating, right? Too much of getting this feeling of hunger, like, Then second thing is you get polydipsia, right? Too much of drinking, polyuria, too much of urination. That's what very common three things. And apart from that, people start feeling tired, lack energy. We have seen some people coming to a platform with depressed and anxiety, right? Then they're getting up in the middle of the night to going for pee and drinking too much of water, as I said, too much of eating, then itching, then infections, and a lot of things associated to the type 2 diabetes. Okay, next slide, please. The root cause. We need to understand the root cause. If you see this one, can you zoom in this one, Juveria? Especially this diagram. This is a very important diagram. So there are three things happening here: impaired insulin reception. Second is reduced glucose uptake. Third is progressive beta cell dysfunction. No, I think we're taking a second. No problem. Leave that. No problem. Leave that. Okay. So now what is happening is, if you see the left side of the cell, which is healthy cell. Okay. The yellow things what you are seeing is nothing but the glucose. Okay. And on the right side is insulin resistance. They have developed insulin. What is insulin resistance? If you are exposed to too much of antibiotic, what happens? Our body develop antibiotic resistance, isn't it? Similarly, if you get exposed to too much of insulin to your body, we develop insulin resistance. Why? Because insulin receptors they become impaired because they're doing too much of work, and they got impaired. Right? They push too much of glucose inside the cell already. Too much of cell inside glucose. What insulin doing? Too much is pushing it inside, right? And the second thing, what is happening? Reduce glucose uptake in skeletal muscles and adipose tissue. Because of this, the glucose uptake is not happening properly in the skeletal muscles and adipose tissues. The third thing is progressive beta dysfunction. Because with chronic stimulation, because we're eating every time, as I said, every time we're eating carb, okay, and every time we're eating carb, we're releasing insulin. So this is happening, and because of that, there's too much of overstimulation, and they got exhausted, and pancreas got exhausted, and they're producing too much of insulin. They're not dead; they're just exhausted. Remember that. In type 1 diabetes, they are dead. For that time, we require insulin, but not for type 1 diabetes. For type 2 diabetes, you don't require that insulin. Okay, because the problem is too much of insulin already got released in the body, and because of that, we got insulin resistance. Next slide, please. Okay, now so let's we understand that insulin role in the body, chronic overstimulation. As I said, it's all about sugar. We need to understand that basic problem is too much of carbs in the body. Take me to the next slide. Yeah, risk factors. Risk factors are very important here. Obesity and overweight, because now it is diabesity. They have linked obesity with diabetes, and they name it as diabesity. Most of the obese people are diabetic. So we need to understand that obesity and diabetes are linked, and physical inactivity. Now, if you see muscles, they are considering as an endocrine organ. 40% of our body is muscle. How can that become an endocrine organ? Yes, it is an endocrine organ because it releases some molecular chemicals like myostins. When what is happening? They communicate with the different organs. They communicate with kidney. They communicate with skin. They communicate with liver. They found that even muscles. So when people are not using much of muscle exercises and they keep themselves sedentary, and for example, bedridden. What happened with bedridden? When people are somebody bedridden, they start to anybody on a bedridden, they develop bed sores. They know that. You all know that bed sores. Then apart from that, you develop weakness in the muscles. Muscles start, when you don't use muscles, they become weak. They become like a stagnant pond, and started what happening there on the stagnant pond? All these germs and diseases start coming in. So that becomes the issue there. So physical inactivity is another risk factors for type 2 diabetes. So people who are inactive, having a sedentary lifestyle, that's another reason. And before 1980s, people used to walk, people used to communicate, people used to interact with a lot of. Now, after the advent of vehicles and internet and all that, so people have just stopped doing too much of physical activity, and that our bodies, our humans, we need to keep active our physical active body, right? That's not happening, and that one of the risk factors for type 2 diabetes. And then the diet, as I said, it is the carb, which is the processed food, which actually goes and convert into fat in the body. And when we convert it, when we eat, what happens is when we eat, it becomes, it's a big topic. Actually, I don't have time now. Let me quickly there. I think already we finished 30 minutes now. Family history, ethnicity, age, high blood pressure, and gestational diabetes. These are all the risk factors. Next slide, please. I want to take you to the important slide. Yes, so we need to understand this very important slide, that's the metabolic syndrome, the root cause of modern diseases. So how are we developing this metabolic syndrome? You see the fattening carbs. You see the right chart here, right side in the chart, you'll see that fattening carbs, which we eat, they release too much of insulin, they trigger insulin, right? Every time we, as I said, every time we eat carb, insulin is getting released. Every time we eat carb, insulin gets released. Every time we eat carb, insulin gets released. So what insulin is doing? What is the role of insulin? What is the role of insulin? We will understand that what it does is creates inflammation. Too much insulin is needed. It's a life-saving. We understood that in type 1 diabetes, life-saving. But in type 2, what is happening? There's too much of hyperinsulinemia is happening in the body. Because of that, it creates inflammation across the body. What is happening? Arteries are getting thick. You get hypertension. And what is insulin is doing? Insulin has 2-3 important roles. What it does, it converts the glucose and it pushes the glucose into the cell, and the cell utilizes glucose as energy, right? And that the next thing is what it does, it converts the extra glucose in the form of glycogen that's formed in the liver, right? Then after glycogen, when even glycogen that's a small it's a very less form of storage in a form of energy. After that, what happens? Then glucose is more their body, more sugar is there in the body. What is happening to that extra sugar? It is converting into fat. So it is the glucose which is converting into fat, and people develop obesity. So that's next one. One is hypertension, right? Inflammation of the arteries. The second is obesity. Then what is happening? It leads to fatty livers also. You see that fatty liver, right? And because of fatty liver, again, it's like a vicious cycle of fatty liver. And when you eat too much of fructose, people who eat too much of fructose, directly to their fatty liver. And because of fatty liver, again, insulin resistance. And what happened? Definitely triglycerides, high triglycerides, and low HDL. HDL is supposed to be a good cholesterol, that the quantity of the good cholesterol comes down. Next slide, please. So there are two toxicities in the body. One is glucotoxicity and one is insulin toxicity. We have to understand this very clearly. There's two toxicity, insulin toxicity and glucose toxicity. But problem is, we all doctors, conventional doctors, they're focusing only on glucotoxicity. Why nobody's talking about insulin toxicity? Because insulin is creating so much issues. Like, it's causing a lot of issues, as we just said. Have you just seen that, right? Obesity, we're seeing that because of insulin, hypertension, insulin, isn't it? So all these issues are already happening in the body. When somebody says pre-diabetes, it's not, people get a fake sense of thing like, okay, fine, it's fine. It's just pre-diabetes. Fine, I'm just borderline. No, it's not borderline, because something else is happening. When you develop this first sign of, when you see the first high rise in the blood sugar, it has to take at least for 10 years to see that, for insulin to work for at least for 10 years. So before that, 10 years, what is happening? Every time eating carbs, insulin is releasing. Every time, in response to that, compensating with extra insulin. Our pancreas is releasing, overstimulating the pancreas, too much of glucose overstimulates the pancreas, and more of insulin being produced there, right? So that insulin getting too much of release, and that insulin is creating insulin toxicity. Nobody's talking about that. He's already patient who's having pre-diabetes, already he must have developed a lot of other issues behind the scene. So we need to talk on that. We need to work on that. We need to focus on the root cause immediately. That's the high time. It's already late. Pre-diabetes is already late. It's not the beginning. It's already late, because 10 years before something else is happening. That is, repeated insulin is getting released every time eating. I'm repeating this regularly. Every time eating sugar and carbs, insulin is releasing. And because of that, hyperinsulinemia, and we develop at the end, it says, I can't release more insulin because overstimulated. They are being exhausted, pancreatic cells. Next slide, please. So here, so it will not leave any organ. It will affect the microvascular complications also you'll see, like in a small arteries, small vessels, and in microvascular complication also you see in major arteries, like cerebral arteries, you get stroke, heart, you get coronary artery disease, atherosclerosis, right? Then in peripheral, we see the peripheral vascular diseases, right? Then we see in the minute in the small vessels, you get retinopathy, eye damage. Then you get nephrons get affected, kidney gets damaged with this, and we know that neuropathy, nerves get damaged, and blood supplies also get reduced to lower extremities. People develop cold feet and all that. People develop pain in the nights, right? All these things. People lose their eyesight slowly, right? Because it is affecting every organ. It is affecting every organ, and it has become the leading cause of blindness in the world today. It has become the leading cause of heart attack, leading cause of strokes, renal failures, and Alzheimer's, dementia, which is very common in these days. All, and they say it's type 3 diabetes now, Alzheimer's. This is all linked to too much of sugar in the body. When eating too much of carbs, too much of sugar in the body, there's inflammation all across the body. So whole body is inflamed. And because of that, our cells, our organs started getting rotting in our body because of too much of sugar. Next slide, please. So the reversal paradigm shift. So traditional diabetes focuses lowering on only blood sugar. They're focusing only on blood sugar. That is a symptom, right? As I said, metabolic syndrome here, obesity, hypertension, cholesterol, right? PCOS and fatty livers, they all form of metabolic syndrome only, right? They're all symptoms of that metabolic syndrome. They are symptoms of, they're not the disease per se. So if you go to a doctor, with a fever, doctor should not only give you paracetamol, but he should give you some anti-inflammation or anti-inflammation or antibiotics for infections or inflammation. It could be fever, could be because of inflammation or because of infection, isn't it? The doctor should give you both, right? But here, what doctor is giving, they're just giving you for the sugar. That's a symptom, but they're not focusing on the insulin resistance, which already there, insulin toxic. They're not talking about that. And because of this, what is happening? You're only being focused on the symptom side, right? So only symptom. And what is happening? The root cause is getting worse. That's why you go to a doctor, they put you on one medication, second medication, third medication, and then put you on insulin back. And that's when your whole situation goes back to so severely worse. And I've seen people dying within 2 to 3 years with severe complication. They're developing strokes when they put on insulin, because already the problem is insulin resistance in the body. Because every time you're eating carbs, insulin is getting released. Eating carb, insulin is getting, and you're developing too much of insulin, hyperinsulinemia, and pancreas got tight. That's it. And the reversal paradigm, what is a reversal paradigm? What we are trying to do is fundamentally different approach. What we are doing is, because there's too much of carb, we need to understand that. If you understand the problem here, the solution is easy, isn't it? The problem we understand, that is carbs. So what we have to do? Reduce the carbs. Simple, right? That will break the cycle. Otherwise, don't break the cycle. All your symptom you're taking is only symptomatic cure. If you're not focusing on the inlet, what you're eating, if you're not conscious, if you're not mindful, it's not going to break. You're not going to break the cycle. Your condition is going to worsen, to be very frank. And the other thing is to burn the extra fat, what you have, right? Reduce the intake and burn the extra fat, what you have. Next slide, please. How are you going to burn it? We're going to help you on that. We'll discuss a little bit on that. Yeah. Like intermittent fasting, we'll do also. So now 2 major takeaways today is reduce sugar carb intake and burn extra sugar. 2 things. This is very simple to understand type 2 diabetes. It is very easiest thing on our platform. We have some clients with us today. We have with me Asra ji is there. I have with me Ramya ji is there. I have with me Shadab is there. All 3 clients, we have them reverse their situations, and all 3 of them are there for you guys to communicate and have some kind of discussion with this directly with our existing clients. Okay. So next slide, please. I'll not take much of time here. Oh, yeah. So what is eMedicard? So what we did with eMedicard is we have because what happened with me, let me tell you a little bit story about myself. I developed a severe heart complication, and I met with a severe heart attack. Okay. In 2021. Okay. I was lucky enough to be picked by the nurses on the road, and they diagnosed me on the road, you have a heart attack, because I was not having any signs of heart attack, because I was thinking I was having good lifestyle and all that. But I was going through stress, because stress plays such an important role. Mr. Kaushal will talk about stress in a bit. I was going through stress, and because of that, I have developed too much of cholesterol, triglycerides, and all that in my blood, and because of that I developed atheroma, atherosclerosis. Probably it's long, it's not just quickly thing. Also, I was going through a lot of stress in almost 4-5 years those days, and I was too much of focusing on too much. My time was putting on work. I was working till very late, 2 o'clock, 3 o'clock, and my lifestyle was not that great, to be very frank. And because of that, I developed heart issue. And when I developed heart issue, thanks to NHS, they saved my life. And today I'm alive thanks to God. And after that, I give my all credit to NHS. After that, they saved my life, no doubt. But after what happened is, after they put me 2 stents, they wanted to put defibrillator, because my heart, almost, they said some 75% of my heart was not working. They decided for defibrillator on my heart. But then what happened is, my mother gave me some wisdom. I took from her. My sister from US doing research on food, she gave me some wisdom from there. I took from there. I started doing research on these things, because we in medical school, we have been totally trained on pharmacological interventions only. We have been only trained on the big pharma. We have brainwashed only related to big pharma. That we, trust me, in my medical school and any medical schools, global medical schools, right? It's been totally big pharma dominant. Our academics are dominant by big pharma. What they did? In my medical school of 5 years, we did 5.5 years of our medical schooling. There must be almost 400 to 500 hours of lectures they're given pharmacology. But when it comes to nutrition and diet, which plays such an important role, you'll see that. You'll see when you talk to our clients, they'll see that how our food as medicine has changed their life, how they they came out of all the medications today, right? So you'll see that. But unfortunately, we doctors have been kept away from this knowledge, this information. But I got this information on myself. I started working on myself. I started working on my heart issue. I started understanding why I'm getting old, why I'm getting this coldness and clammy skin, and why am I still the issues, why I'm still, my heart is racing, why I'm still having these issues. But when I put this natural things into my life, all disappeared. All simply disappeared. I don't have to take no medication. I'm saving NHS almost 250 pounds every month for my medications. Otherwise, I was taking almost 9 medications. Today, I take 0 medications. I do my yoga, I do my push-ups, I just change my food as my medicine. This is perfect saying there. If you don't make food as your medicine will become your food. So this is a perfect saying. What we did in search of this, when I learned about food and all that, and I learned about prophetic ways of lifestyle, because Prophet Muhammad Sallallahu Alaihi Wasallam, our last prophet of the times, he has lived life for the mankind to follow, because he never used to overindulge in food. Moderation is the key. So that's what we got it. Moderation is the key. When people come to us, we don't talk about calories to them. We don't talk about portion control. We'll give them the habit of simply dividing the tummy into 3 parts. Dividing the tummy into 3 parts. Like 1/3, 1/3, and 1/3. 1/3 is food. 1/3 is water. 1/3 is air. That's it. This is mindful eating. The prophetic wisdom, right? Then we talk about intermittent fasting. He said, like 2 days in a week, fasting is very good for mankind. Today, all the scientists, there's so much of clinical trials happening on intermittent fasting. Every second doctor, third doctor in US and UK, they all talk about intermittent fasting now. Suddenly, everybody talking about intermittent fast, because intermittent fasting, there's a hard plaque and soft plaques in the heart. When you develop this atherosclerosis changes, coronary artery diseases, the soft plaques can be reversed, they say, with intermittent fasting. Can you believe that? So fasting has such a great miracle there. So we put people on intermittent fasting, mindful eatingness, okay, the prophetic wisdom. Then we got a bit of Ayurveda, like body composition. Every body is divided into Vata, Pitta, and Kapha, which I think Dr. Namrata will briefly describe on that if she has a time there. Then we got definitely the evidence-based science from Harvard University, and we follow the father of intermittent fasting. That's called Dr. Jason Fung from US. So we got this information from Harvard University, the evidence-based science, and we integrated that with the ancient science, Ayurveda, and prophetic wisdoms. and we're getting wonderful results of our platform. We have 3 beautiful programs. It's just not we are helping diabetes, we're not helping diabetic. We are helping people who have been stuck for medication for almost 25 years on hypertension, diabetes, and cholesterol. We could reverse 25-year-old in a span of just 3 weeks, 5 weeks to 7-8 weeks. That's it. You don't have to go for years with us. Just in months, people are getting reversed with our condition. Thank God. So let me just, I think I'm done with my lecture. And the other things are there. The next slide, I think you could just, yeah, the 3 pillars. This one last slide is there, if you like to talk that, because when people come to a platform, we just not talk about the food. We just not talk about the plate. We give them the empowerment. They'll get knowledge. They will not only see the beautiful thing about our platform is, and the old doctors, we are just doing what our old doctor used to do. They used to empower you. They used to empower every patient who come to their clinic. But now they no empowerment, because doctors are still, they themselves are not empowered, to very frank, unfortunately, that these things can be reversed, right? When I talk to my friends, some of the friends, they just think, what am I doing, man? I mean, this is what's happening on our platform. Come on, you stop killing patients now. Start looking from the root cause perspective. So apart from this, we focus on 3 S's: sleep, stress, and sports. Sleep, we know that, very important. Stress, very important, linked to cortisols and too much of inflammation, again, definitely. Then we have sports and activity. As I already told you, that exercise releases some chemicals, myosins we call it, and then that's actually the chemical peptides and proteins. When we do this contractions and resistance trainings on that, that helps to, as an anti-inflammation, it helps in resetting the metabolic health, and that plays another big role, because 40% of our body is with the skeletal muscle. So activity is very important. We put people on yoga at our platform, and we put people on basically what we do is like trying to put back our people who are coming to the circadian rhythm, because people have lost, they have actually distorted the circadian rhythm because of the lifestyle, because of sedentary lifestyle, one of the reasons. And there's too much of entertainment around us. People are not being active. Too much of food and too much of carbs, also too much of sugar, also is what is creating is people not able to sleep on time. So I think I'm done for this one, and Dr. Namrata will talk more on the food side of it. We have something called LCHF diets, low carbs and healthy fats diet. We have something on fasting mimicking diet. She'll talk about that. She'll talk about keto diets. We have keto diets. She'll talk about a little bit about food, how different food can go and improve the insulin sensitivity. The foods, you just add those foods to improve the sensitivity. You don't have chemicals, too much of chemicals. Why too much of chemicals and giving too much of burden to the body, chemicals, and why you're trying to pamper your disease. Don't have to do pamper disease. You don't have to. You have to live with the disease. Why you have to live with the disease? Just reverse it when you can do that, and it's easily possible. And so I hand over to Dr. Namrata. Dr. Namrata, please go ahead, please.
Thank you.
And at the end, at the end we have, at the end we'll give them the opportunity, because we have 3 clients with us. We have reversed those situations, and opportunity if anybody like to discuss with our clients directly. And you can ask us also a question after the end of this. Yeah, Dr. Namrata, please go ahead, please.
Yes, thank you, sir. So, hello everyone, I am Dr. Namrata. So, I'll be talking of the power of diet and nutrition in reversing type 2 diabetes. Okay, so why food plays a very important role here in reversing diabetes is this. First, we will understand what are macronutrients and what are micronutrients. Okay, our food is composed of all these nutrients and vitamins. So let me tell you a bit about what is this actually: carbohydrate, proteins, and fats. Okay, so now you see here, macronutrients comprises of carbohydrates, proteins, and fats, which form the major component of our food. Okay, and the micronutrients, which are the very minute substances like nutrients and vitamins, these are the micronutrients. So our food is comprised of macronutrients and micronutrients. Any disruption in macronutrients or micronutrients will give you a nutrient deficiency, a vitamin deficiency, or a chronic disorder. As when we have lots of carbs, lots of fats, we become obese, and when we have lots of carbohydrates, we either get diabetes, we either get hyperlipidemia, and when we have disruption in micronutrients, you get vitamin D deficiency, vitamin E deficiency, and lot many things. Okay, so how these play a very important role in managing and reversing diabetes, I will explain you all these things. Okay, so see, carbohydrate plays a very important role when it comes to diabetes, because carbohydrates are the main source of energy in our body. Our body has two main sources of fuel, that is glucose and ketones. So whenever you are having carbohydrate in your diet, body instantly converts into glucose, that is the main form of fuel. Okay, the second one is ketone, that is formed from the fats. Ketones are the fuel sources that are formed from fats, but we are in so much abundance, we are living in so abundance these days, that only we fill our body with carbs, simple carbs, processed carbs. That is why our body is overburdened with glucose, which in turn gives us as diabetes. So diabetes is a gift from all the junk food we give to our body. Okay, next comes vitamin D. Vitamin D was earlier a vitamin, but now in today's era this has been termed as a hormone. Why? Because it
We
plays
can see.
such an important role in
I think. Let me. Now I can see the slides. Sorry. Yeah.
yeah, is it visible?
Yeah. Now it's visible. Yeah. I just did that.
Okay.
Yeah. Go ahead, please.
Okay, so vitamin D was earlier an vitamin, but now it has been termed as a hormone. Why? Because it plays such an important role. You see, any metabolic process in your body, any process in your body, from A to Z, from mouth to anus, it plays a very important role. Whether it's your metabolism, whether it's your insulin production, whether it's your sleep, it's your liver functions, vitamin D plays a very important role in everywhere. Okay, so apart from vitamin D, vitamin B is also very important for reversing diabetes. Why? Because it is important for glucose metabolism. In diabetes nothing happens, glucose metabolism gets disrupts and insulin sensitivity increases. So when you deal with the root cause, your disease get reversed, right? So here at eMedicard, we play with these macronutrients, we play with your micronutrients, we correct your disease at the root cause. We give you supplements, we give you natural supplements, whatever is required for your disease to be reversed. So here, talking particularly about diabetes, we incorporate all these micronutrients in your diet, keeping individual needs in mind. Okay, next comes the role of nutrition. Why the role of nutrition is important, what to eat and why to eat, that is very important. So let me take you to this very interesting plate. Now this is the diabetes plate which we give to our clients whenever a patient is coming for diabetes reversal, and in turn we give to every patient, because this is the actual way of eating we follow. This is the traditional, how earlier we used to follow the kind of diet we give to a patient. So this is a therapeutic medicinal diet, the diabetes plate given by American Diabetes Association. What this plate says: fill half of your plate with non-starchy vegetables. Non-starchy vegetables means no simple carbohydrates. If in vegetables also carbohydrates are present, which are the starchy vegetables, let's say potato, but we don't give that because it will in turn increase your blood sugars. So we fill your half plate with non-starchy vegetables. 1/4 of the plate is filled with carbohydrates. Now carbohydrate, that doesn't mean simple carbohydrates. The carbohydrates we are talking here are filled with fiber, and they're complex carbohydrates which are easily digestible, and they don't shoot up your blood sugar. And the last 1/4 plate is filled with protein sources, because in any disease, here the thing is, I'm talking in very general form, but depending on the disease of the patient, we can moderate this plate. So this is particularly for diabetes. Let's say if a patient is coming with diabetes and kidney disorders, so we can't incorporate much protein sources because the body is very much compromised to digest protein. So this is just a general phenomena I'm explaining. So 1/4 of the plate will be filled with protein sources, and the rest water and 0-calorie drink. We give our patients this diabetes plate along with metabolic drinks. What does metabolic drinks does? It increases the metabolism to reduce the blood sugar and in turn reduce your weight and in turn reverse your diabetes. So this is the basic understanding of the diabetes plate which we follow at eMedicard Global to reverse diabetes. Okay, so this has been proven. This is given by the American Diabetes Association, the biggest association of diabetes. Okay, so now let us see what all options you can have when you are making this plate. So the American Diabetes Association plate method says half of the plate you have to fill with non-starchy vegetables. What options you can have? Broccoli, asparagus, cauliflower, zucchini, mushrooms, cucumbers, and cabbage. But again, let's say if a patient is having thyroid, we will not give him cabbage, right? So moderation and individual treatment is very important, is the thing, is the prime thing we deliver to our patients and cater to our patients. So then one fourth of the plate is filled with carbohydrates. As I mentioned, we give complex carbohydrates to a patient. Now, what complex carbohydrates you can have? That whole grains, you can have brown rice filled with fiber, quinoa, lentils. These are complex carbohydrates which will not shoot your blood sugar. Then one fourth of the plate you have to fill with protein, any veg source of protein or non-veg source of protein you can have. And as a side dish, always low GI fruits and non-dairy products. See, these days we are not getting pure dairy. Why? Because these are nothing but these are liquid hormones. So we promote non-dairy products. We promote nut milks at our platform. Why? Because we don't want to disrupt your hormones, the natural hormones your body have. Okay. Apart from this, is my screen visible?
Yeah.
Yeah. Okay. Yeah. So I was talking about fruits. So what fruits we give? The fruits which have low glycemic index. What is glycemic index? Nothing. But any food source which will shoot, means how quickly the food will shoot your blood sugar. So we give you low glycemic index foods. We are not restricting you with any sort of eating. We give you your favorite foods, but in moderation. Okay, so this is the diabetic plate method which I just told you. And coming to the recommended daily allowance, what Diabetic Association delivers is carbohydrates, proteins, and fats. So the ideal range, the RDA for carbs is 130 to 225 grams per day. Proteins are 75 to 100 grams per day. Fats are 44 to 78 grams per day. But this is just a general guideline. This has to be given to individual needs, like personalized proportions should be given to every patient. Okay. Now, coming to different types of diets we give to our patients for diabetes reversal and many more disease reversal is first low carbohydrate, high diet, because carbohydrate is the main issue when diabetes comes to a discussion. What LCHF diet is? In this diet, we are reducing the carbohydrate intake and increasing the fat intake to our patients. Why? Because I told you in the beginning, our body has two fuels, glucose and ketone. So what happens when you are taking fat? Ketone production starts. So ketone becomes the prime source of energy, and your body starts to metabolize the stored fat, the stored glucose, and then your insulin sensitivity decreases and your blood sugars become normal. So this is the basic understanding of LCHF diet. Okay. Next comes, yeah. So whatever diet is best for you, individual catering to individual needs, you can just scan this QR. Everyone listening to me, you can just scan a QR for a personalized treatment plan, and we can help you there. Okay. Next comes the ketogenic diet. Ketogenic diet, this is nothing but the subset of low carbohydrate, high fat diet. In this diet, we are giving a higher amount of fat and just reducing the carbs to very minimal. What will happen? Again, ketosis will take place. New ketones will form. Ketone will become the new prime source of energy, and your body will use the stored fat and stored glucose. Okay. This will help you to reduce your HbA1c levels significantly. Okay. But again, keeping in mind the other combination diseases you have, another very good and proven diet is fasting mimicking diet. Fasting mimicking diet is nothing but we are actually fooling the body, feeding the body, but still keeping in a fasting state. So ideally, fasting mimicking diet we give to our patients only for 5 days. This is nothing but only plant-based diet. We don't incorporate low GI fruits also, because we are fooling the body with fasting state but still feeding the body. So this is the trick we play with the bodies. So very important and very helpful. Yeah, then comes the time restricting feeding, also fasting. So we give numerous types of fasting to our patients. Now there is a saying, fasting, anyone can fast, but only a wise man can break the fast. So the concept of fasting and the concept of breaking of fasting plays a very important role when we deliver therapeutic fasting to our patients. That's when empowerment comes. So yeah, different types of fasting we give to our patients. I'll just take you that. So intermittent fasting, very important and very beneficial, 16:8 ratio. So what the concept of fasting here is, we are reducing the eating window of patients. Eating window is reduced, so body doesn't have to release insulin again and again. Again and again insulin is not released. So 16-hour fasting is there and 18 hours of eating period is there. Okay, this is the intermittent fasting ideally which is used. Now another fasting is alternate day fasting. One day of eating, one day of fasting is incorporated. Many other fasting are done at our platform: water fasting, raw diet fasting, which are beneficial. So now the main effect of fasting is that, see, fasting is a boon for mankind. Why? Because with each hour of fasting you have done, body gives you immense results. Let me give you a few quick results of fasting. See, early when you have just started the fasting, what happens? Growth hormone starts to release. Your body feels immense relaxed and immense regenerated. Why? Because the energy which was concentrated in digestion now has been diverted to healing, now has been diverted to different parts of the body. So this is what happens when you start to do fasting. First, energy shoots up, growth hormone releases. Growth hormone is responsible for healing, repair and regeneration. Growth hormone starts to happen. You are mentally relaxed. What happens? Body goes into deep ketosis state. Deep ketosis state, again ketone production starts to happen. Ketone, the second fuel of the body, starts to come in action and depletes the stored fats, depletes the stored glucose. So your body reduces the insulin sensitivity, in reduces the fat. Okay, so these are the few benefits I have told you about fasting. So that's all. Take control. Your food is medicine. Don't have to take any medicines for diabetes, for type 2 diabetes especially. Reversal is possible, of course. And for any more queries and a personalized consultation, you can just scan the QR, share it with your loved ones, because we don't want to feed you with medications at our platform. eMedica Global helps numerous patients all over the globe to reverse diabetes. And the 3 S's which I was about to talk about: sleep, stress and sports. So sleep works as a medicine. Sleep works as a medicine. Why? Because a lot many things happens in sleep. Every day means 24 hours, 12 to 14 hours we are working, but deep relaxations takes place only at the time of sleep. Next is sports. Until and unless your body is physically active, no disease you can reverse. So very important, you have to do for physical, you have to strain your body towards physical activity. Last, very important, stress. So I think Mr. Kausha will guide much more about stress and the role of stress in reversing metabolic disorders. So off to you, Mr. Kausha.
Thank you so much, Dr. Namrata. Can everybody hear me?
Yes, sir.
Yes.
Okay, I'll try to see if I can upload my slides.
Yeah.
Okay, I'm just putting it up. Can you see my slides now? Bismillahirrahmanirrahim.
Ji.
Can you see the slides?
No, sir. Yes. No.
No, you cannot see the slides?
No.
Okay, I'll stop sharing then. Let me know if you can.
Yeah,
Can you see
we can
me?
give it to.
No, it's
Sorry.
okay. Can you see? It's okay. Can you see me?
Yes.
Can you see my face? Okay.
Yes.
So I won't share the slides. I'll just go through it, inshallah. A'udhu billahi
Okay.
minash shaitanir rajim. Bismillahir rahmanir rahim. You know, this managing stress is a very important topic because there is a strong documented link that exists between chronic stress for both diabetes and heart disease. Chronic stress meaning long-term stress, when people are not able to manage their stress, because if you don't manage stress consistently, it becomes depression. So chronic stress triggers the release of hormones like cortisol and adrenaline, which raises blood sugar level and increases inflammation, and it boosts heart rate and elevates blood pressure. So this combined psychological strain can directly accelerate the development of type 2 diabetes and cardiovascular disease. That's why managing stress is very, very important. I will send the slides to Dr. Khan, and you can have these slides afterwards if you want. For those who want it, you can email. I can email them to you. So what I'm going to talk about is how best can we manage stress. What are the 7 effective ways of managing stress? But firstly, before I do that, I'd like to talk to you about mental health and mental illness. Everyone will go through mental health, just like everyone will go through bad health. People will go through good mental health and bad mental health. Everyone, every human being, according to the World Health Organization, at any one time, 70% of the population will go through mental health. I'm talking about bad mental health, because life is such that we are always stressed somehow. But those people who are able to manage their stress can effectively live their life much, much longer, but also be able to resist type 2 diabetes and heart disease. So the difference between mental health and mental illness is a disease, is a condition where you have to have treatment. So we're talking about schizophrenia, bipolar, depression. So mental illness is different to mental health, but I'm talking about generally with mental health. So what are the 7 effective strategies that we can deploy to effectively manage our stress? The first one is positive thinking. It's important that we think positively. How do we think positively? What we need to do? First of all, we need to look at how best we can resolve the solution of a problem. Rather than dwelling on the problem, we need to reframe our negative thoughts and practice self-compassion to reduce mental strain. When you do that, you'll be able to much focus on the present state of mind that you're in. One way of doing positive thinking is that giving the benefit of the doubt of somebody who might have wronged you somehow. They might have said something where it has hurt your feelings. But self-compassion is where you're giving the benefit of the doubt, so you don't keep a grudge against that person who's done wrong to you. And that is positive thinking. If you are always a positive thinker, you will be successful in daily challenges that you face from people. Because sometimes people can be very harsh. So a positive thinker will be able to manage their stress much effectively. The second one is adequate sleep. And Sister Namrata mentioned sleep. It's a very important quality to have. Getting enough quality sleep helps to regulate your emotions. It helps to improve your concentration and restores your body's ability to cope with stress. And there is a sleep cycle as well. So there is a REM, there is deep sleep, and there is shallow sleep. And therefore, we need to focus on deep sleep. How can we improve our deep sleep? First and foremost, we should have a consistent routine. We should go to bed early and wake up early, but at the same time. So if you're a believer, if you're a spiritual, if you are a Muslim, after Isha prayer, the last prayer, it's important to go to bed. This is the recommendation of our beloved Prophet, peace and blessings be upon him as well. Waking up early, say for example, many people who are wealthy, intelligent, articulate, many psychologists, even people like Bill Gates, Jeff Bezos, and Elon Musk, they get up early at 5 o'clock in the morning. But a believer, a Muslim, will wake up early in the morning to pray for Fajr. those people who wake up early, their antibodies work better. So having a constant routine helps to improve your sleep quality. Next one is the restful environment before you sleep. Having a cool bedroom, dark and quiet. And also avoid substances like tea or coffee before you go to sleep, because this disrupts the sleep. And try to practice relaxation techniques before going to bed. And avoid social media. Do not use your phone, your smartphone, before you go to sleep, because that can affect your sleep. Now, the third thing is eating healthy. Dr. Nirmata mentioned that this is the most important part, because you are what you eat. There's a saying that you are what you eat. So it's important that you eat a balanced diet which supports brain function and energy levels. While moderation helps avoid stress linked to overeating or poor nutrition, it's important that you select what you eat. And this is why eMedicard can help you through Dr. Nirmata about what's best to eat. Everyone has their own unique way of having a diet, because it depends on your condition, your lifestyle, what you've been consuming before, what kind of ailment you're having. It'll be specifically related to your diet. It'll be subjective rather than objective. So eating healthily is important, but also, as Dr. Saab said earlier, eating in moderation. 1/3 for food, because a portion of your stomach for nourishing is important that you have healthy food. 1/3 for drink. This is the space for beverages like water, juice, or tea. And when I say juice, I don't mean the box juice, which has been so much sugar is in it. I'm talking about fresh juice. So fresh apple, fresh pineapple, fresh juice, fresh fruit juice, or tea. And also coffee in moderation is okay as well. Black coffee, I drink black coffee in the morning. But 1/3, leaving it empty. This is crucial for digestion, allowing food to move and preventing bloating and discomfort, as well as leaving room for breathing purposes. So 1/3, 1/3, 1/3. This is really crucial. Eating less, eating in moderation, but apportioning 1/3 to it. The other important aspect about eating is mindful eating. First, we should eat slowly. When you eat slowly, the neutrons to your brain from the stomach is saying you're getting full. So if you eat slowly, you eat less in the first place. Have we not been to a restaurant sometimes and we've had the starter, but before the main meal comes, we're already full? And this is the reason why. It's called mindful eating, but eating slowly. But when you stop eating when you're satisfied, that's the best way. This is what the Prophet, peace and blessing be upon him, recommended. If you still got one morsel of food to fill your stomach, stop. Because this helps you to be comfortable and not overly full. Pay attention to your food and your stomach signals as well. So if you're feeling full, even if you've had little food, stop eating. Because what you're doing is you're putting in food on top of food. And when I say eating less food, avoiding snacks, people nowadays eat a full breakfast, then they'll have a snack at 11 o'clock in the morning, then they'll have dinner at 1 o'clock, but they'll have another snack at 3 o'clock, and they'll have another heavy meal in the evening before they go to sleep. That is compiling food on top of food. Let your food digest in your stomach. Each food nutrient that you eat, it takes time to digest food. Otherwise, what you are doing is piling food on top of food. And this is where obesity occurs. Also, choose wisely. Focus on nutrition foods for that food portion that you're eating. And this is where eMedicard helps, inshallah. The fourth aspect about managing your stress is exercise. 80% of what you eat, but 20% is exercise or movement. If you don't want to do exercise, at least be physically fit through physical activity like walking. So don't take the lift, don't take the escalator, use the steps if you're able to manage. If you can't, then you can do non-jumping exercises, for example, or even stretching or playing sports. So this helps to release endorphins that naturally reduces stress and boost your mood. It really does affect your stress levels. And the main types of exercise is aerobic or high intensive interval training, uh, resistance training, like for example using weights, or doing push-ups, or your own weight by doing squats, mountain climbers, and things like that. There's so many YouTube clips available now for exercise. And then eMedicard also helps you with yoga, your stretching exercises. So yoga or Pilates stretching exercise is very good for you as well. So those are the main types of exercise. The fifth way of managing your stress is to let go of past grudges. A lot of people keep in their heart the grudges against somebody who has done wrong to you. Because forgiveness and emotional release frees you from carrying resentment, which can be a major source of ongoing stress. So it's better you might not want to forget because you don't want to make a mistake again. But sometimes it's better to let go of those toxic friends that you might have. It's not worth it for you. So if they're the ones who keeps you on track and criticizes you, are not positive, then it's better to let go. Obviously, you cannot let go your spouse, your children, your parents, even your neighbor, for example. Then you have to manage that, how you deal with that. Your interpersonal skills has an impact. How you talk to them, your own tonality and body language and words that you use, so that when you're good with them, they'll be good with you. And don't misinterpret whatever they say to you or whatever they do. Give them the benefit of the doubt. That will help you to let go of any grudges that might be there. But when a problem does occur, acknowledge it and accept it. Recognize the pain and anger, accepting that event happened and you can't change the past. It's happened. But gain perspective. Try to see the situation from the other person's viewpoint. Put yourself in their shoes, and practice empathy. Understand that everyone makes mistakes. This doesn't mean excusing behavior, but recognizing shared human imperfection. In Islam, it is said, hate the sin, not the sinner. So hate the mistake that the person has made, not the person who made the mistake. And this is the best way of practicing empathy and choosing forgiveness. The first beneficiary of those who forgive others are themselves. The sixth one is attitude of gratitude. Psychologists say that those people who thank other people have a better mental health outcome compared to those who don't. Practicing gratitude shifts focus from what's lacking to what's meaningful, and it promotes a calmer and more positive mindset. So thanking others, by the way, for those who have done good to you, it's also thanking Allah, thanking God. Just imagine. That is the psychological language of the Quran. So how can we practice gratitude? First of all, to be attentive, to have this awareness, noticing the good things and positive aspects in your life, rather than living on autopilot. Look at all the blessings that we have that God has given us. And our beloved Prophet, peace and blessings be upon him, said, look at those who are below you, not the ones who are above you, so that you can be thankful to the blessings that Allah has given you. So having that kind of gratitude helps your stress level. Consciously recognizing and accepting these good things, taking a moment to feel thankful. I'm currently in India. There's so much poverty here. I'm seeing people who've got no food. They've been given food. They've been given clothing. So those people who are living in UK, they've got shelter, they've got food, they've got clothing. The Prophet, peace and blessings be upon him, said, if you've got these things, you are the richest person in the world. Just imagine. 2/3 of the world's population, in fact, 1/3 of the world's population is in poverty. The second third is in absolute poverty. They don't know when the next food is going to come on their plate. They are dependent on other people. And 1/3 is who are well off. They've got food, they've got fridge, they've got a car. So we should be appreciative. We should be having that attitude of gratitude. valuing and feeling grateful for the positive experiences that you have from people and the qualities that they give you, but also from God all the time, consistently. The last one is being charitable. Studies show that those people who are charitable and give their time to help others, or money, or both, any kind of acts of kindness or service foster connection, purpose, and emotional well being, which can ease stress. There is empirical evidence to suggest this. And what are the benefits of giving? It does reduce stress. This is a positive feeling. It lowers blood pressure. Research indicates that giving to others can lower blood pressure. This is amazing, with effects comparable to a healthy diet and exercise. Just imagine, people who are millionaires, they are millionaires because they're so stingy. If they can share some of that money, some of that wealth, and share some of their time and skills. In fact, if somebody does come to you for help, and you want to give that time, and you've got the skills to give that time, give it to them. Because otherwise, you are denying the blessing from God, because that person was sent to you by God. So don't deny the blessing. So benefits of giving really does reduce stress. And it also increases self-esteem. Helping others improves self-worth and provides a sense of purpose. And studies also show that those people who are volunteers in doing charitable work, they live longer. There is some evidence to suggest this. They live longer, particularly when they are driven by a genuine desire to help. The intention has to be there. So I'll leave it there because my time is up. Any questions, please?
Thank you so much, Kaushal bhai. That's great. That's very nice. As always, mashallah, thank you to you for taking us to a beautiful journey through your beautiful presentation. Definitely, attitude of gratitude we all have to keep. That's what takeaway from your discussion is, and definitely giving will help you. And taking off hypertension by giving, that's something very new, and that's very interesting. Very interesting to know that, definitely. So we have now with us, we have two of the clients with us who we have already helped before. They came to us a couple of months back. We have with me Shadab. He's just 31 years old. He was suffering with diabetes for a year when he came to our platform. And then let me introduce him now. Let him come here. Hey, can anybody see him? Is he there in this panel? Juveida, can you add Shadab, please? Add to stage. Yeah, he's there.
Yeah.
So Shadab is there with me, and so he's from Manchester. He was put on a medication, and then he was suggested for second medication. That's when he came to our platform. He came with depression, anxiety also, because he's so young. His both parents are having diabetes and all that. And he thought the disease will be there. Once he got the disease, he thought that he has to live with the disease. As he's seen parents living with the disease for years. And here, okay, fine. We can see here. Can you see me? Hello?
Yes, sir, we can see.
Shadab, can you see Shadab? I can't see because I can't see. There's some they've just changed, I think. Can you change that back? Yeah, I think now it's better. Can you call Shadab here on the stage? And so if people want to have some discussion, they can have some questions. How can we communicate? Can people communicate with us? Juveria,
Yeah,
do they have any questions?
They can turn off on their mic and ask the questions. Shadab has just left.
Okay, call Asra. There's another client with us. Asra, please call Asra, please. Yeah, so Asra is also Asra is there with us. She's another client with us, and Dr. Namrata will give a small history about Asra. She's having a couple of metabolic issues and how she came to our platform, what's her age. Dr. Namrata will give a small brief of Dr. Asra, who she came to our platform. We helped her remove her medications. Dr. Namrata.
Yes, thank you, sir. So, Asraji, I welcome you on stage. We have many patients, many viewers watching this seminar. So, Asraji came to us. She is 50 years of age. She came to us with diabetes mellitus. Her HbA1c was 10.6, and she was hypertensive since past 5 years, and she was hyperlipidemia as well. She has pain in numerous parts of the body, neck and shoulder, but with eMedica Global guidance, therapeutic meal plans, lifestyle modifications, she has now been off medications completely. So now Saraji's status is without medications for diabetes and hypertension. So, just a brief history about Asraji and how eMedica Global has helped her relief of such diseases, and we have bring her off medications. Asraji, आप थोड़ा सा बता
जी जी
सकते हैं को how you are feeling after joining the program and पहले क्या कंडीशन था, अभी क्या कंडीशन है, कैसा फील
पहले
कर रहे हैं,
नहीं
बताइए।
पहले बहुत वो था मेरा कंडीशन, अब अल्हम्दुलिल्लाह ठीक है मेरा कंडीशन, और मेरे को बॉडी में एनर्जी भी है, पहले एनर्जी नहीं थी मुझे ऐसी, अभी अल्हम्दुलिल्लाह एनर्जी भी है मुझे। मैं इस काबिल नहीं हूँ, फिर भी मेरे को डॉक्टर साहब यहाँ पर बिठाए हैं, मैं इस काबिल तो नहीं हूँ।
नहीं, थैंक यू असरा जी, आप आए,
पूरा ध्यान से सुना है मैंने बस।
जी जी, थैंक यू। Because a lot of people, I think, understand English here, isn't it? So we need to a little bit translate that what she's talking, that we can do. And Shadab is also with us right now. Shadab,
Dr. Sam, I need to leave because the Maghrib is going to start now. So
okay. Thank you, Kausar. Thank you so much for your time and a great presentation. Thank you so much.
Thank you
for the insights.
Thank you.
Yeah. And Shadab is there. So Shadab is, we'll give a small, Shadab is here, and he's very young chap, you can see, and very handsome man at the same time.
Hi,
so he lives in Manchester. He's one of our clients, and we reverse his situation, and he's also there with us. Shadab, can you just talk a little bit about your story, please, on the camera if possible, or a little bit about your issue, when you came to us and how we helped you reverse this situation? Can you talk a little bit on your side? Hello. Can you hear me, Shadab? Hello. Hello. We can't hear him. Okay, fine. So if anybody has any questions, please here. I don't know if anybody has any questions to talk to, because both of the clients are here and we both are there. We're helping a lot of other clients. There's so many other clients we have in UK. We have clients in India. We have clients in fast African countries at the same time. We have clients in US at the same time now. We have clients in Pakistan also. We have clients all across the world currently. So we have two clients here, one from Manchester, one other one is from India. Asra is from India, and Shadab is from Manchester. And Ramyaji is also there, isn't it? Ramyaji there?
Not now.
Okay, fine. If she can join, she can also join. If she wants to join, tell her to join if she wants to join. Okay, so we have any questions? We are ready to answer your questions, please. Please go ahead. Anybody like to ask any questions with us or with our clients directly? You can ask questions, please. I can see some names here. I don't know, because I can't see many people, Juberia. I think I don't know how many people are there with us. I can see Noreen here, Susette here. Here I can see some Sundus also here. Yep. But are they able to talk? I don't know. Is the mics?
Yes, they are allowed. They can talk.
They talk? Okay, fine. Device not found. I don't know. Backstage people. Fine. Does anybody have any questions, please? So, Dr. Namrata, we can just Asraji, a little bit about Asraji. So, how she came to a platform and how he helped her. And just in a span of when was the date when she joined? Let's go to her room and just quickly discuss about Asra and Shadab. I think we can't hear you, Shadab. So we can talk a little bit about Asra there. And Asra ji, आप हमारे पास कब आए थे? When did you join, Asra ji?
मुझे डेट तो याद नहीं है डॉक्टर साहब
जी
लेकिन
जी
2 वीक्स पहले 2 वीक्स पहले
2 weeks पहले ये okay
जी
2
जी
weeks पहले so आप 2 हफ्ते के अंदर sorry she came 2 weeks back, that's what she's saying, to a platform. And आप क्या क्या मेडिसिन खा रहे थे? What medicines you were on?
मैं शुगर की ले रही थी कोलेस्ट्रॉल की ले रही थी बीपी की
जी शुगर के लिए क्या खा रहे थे आप? शुगर के लिए दवा का नाम बोलिए, name of the medication you were taking. शुगर
मेरा नाम मुझे नेम याद नहीं है डॉक्टर साहब
बीपी के लिए क्या खा रहे थे?
बीपी सेल्टिमेट कुछ है उसको 10/50 सेलिमेट
10
10/50
okay, so you were having Silamet 10/50, correct?
जी जी
खा रहे थे. फिर उसके बाद आप खा रहे थे टैबलेट सीटोलॉन, करेक्ट?
जी जी
Yes.
जी जी. देन आप खा रहे थे आर वार्नी, ठीक है, फॉर कोलेस्ट्रॉल, करेक्ट? तो अभी आप कुछ टैबलेट खा रहे हैं? आर यू ऑन एनी मेडिकेशन? आप
अब
कितने
सिर्फ बीपी की टैबलेट है बस अभी
कितनी खा रहे हैं आप बीपी की?
हाफ
आधी.
टैबलेट
जी जी. और डायबिटीज की रोक दिए, isn't it?
रोक दिए
So you're not taking diabetes tablet anymore, okay?
जी
अभी आपका बीपी शुगर कैसा है? How is the BP and sugar?
बीपी तो नॉर्मल है शुगर की
Okay.
टेस्ट आज मैं डाली हूँ
जी जी
मॉर्निंग
जी
में डाली थी अभी डाली हूँ मेरी बेटी के फोन में है अभी डालूंगी ये सेमिनार
जी.
खत्म होने के बाद मैं डालूंगी
ओके डाल दीजिए, ठीक है, डाल दीजिए आप. तो आपको कैसा फील हो रहा है अभी? हाउ यू आर फीलिंग?
नहीं फील तो बहुत अच्छा हो रहा है डॉक्टर साहब मुझे ऐसा है कि वीकनेस हुआ है मैम जो दे रहे हैं डाइट उसमें वीकनेस कुछ भी महसूस नहीं हो रही सब अल्लाह
ओके
के करम से अच्छी है डाइट एक किनवा छोड़ के बाकी का सब अच्छा है
अच्छा
किनवा
ओके
किनवा जरा खाया नहीं जाता मुझे
अच्छा ओके ओके okay fine. So because we just ask her, I just ask her like how she's feeling with the diet and how she's overall feeling, because her numbers are falling normal now, everything is normal, and she was put on medication. अब जो बीपी की गोली कितने साल का है? How many years you ate for BP tablet?
7 years
7 years she ate BP tablet. And within how many weeks we could help her? कितने हफ्ते में आपका चलेगा हमारे पास? आपके 7 साल की जो गोली खा रहे थे कितने हफ्ते में गए हमारे पास? 2 हफ्ते में, 3 हफ्ते में,
2 हफ्ते में
within 2 weeks, eh?
जी जी
So within 2 weeks we are getting such wonderful results. We have so many examples like this. We have another client called Manruchi. She's
जी
based in somewhere in Punjab in India, and she was put on medication for 10 years, diuretic by doctors, unfortunately. Diuretic
जी
10 for 10 years, and just within 3 weeks, 4 weeks we could able to remove this medication, and BP is fantastic and normal now. So why these people are being harassed? This is what I don't understand by these conventional doctors. By anybody, just go to the doctor, be blood pressure high or high sugar, they're just focusing on values. That's unfortunate thing to happen. Just focusing on values, that's it. You're not talking about root causes. You're not talking about the lifestyle changes. You're presuming and assuming that people who come to the clinic, they need medication. That's wrong. It's not wrong. It's not what you have taken oath of. Hippocrates oath talks about what? No, do not do any harm. There's no doing of any harm of anywhere. But you're harming your body by putting these people on medication for years. Asra was on medication for 7 years now in front of you. And we just removed her from medication so quickly. Yeah, so this there. Shadab, can you talk to us? Hello? Hello. Okay. So yes, fine. I think we can end the session now. If nobody has a question, they are asking. Yeah, Noreen is said yes, it's available. We can send you that. Yes, definitely. Susan, we can send you that thing. Sundus. Yes, because it's all about your willpower. We have some people who are actually alcoholics. I understand. We are even helping alcoholics as well, you know. Then welcome, Suzanne. Thank you. We have some alcoholics. It's difficult for alcoholics to come to a program because they're addicted to alcohol, right? That's what. So initial 1 week is challenge for anybody who come to a platform, because you have been so much addicted to so much of sugars and carbs. Unknowingly, you don't know you're having so much of carbs and sugars, right, Sundus? Yes. So initial 1 week is definitely, you need to try to be very strong, and then after that, you'll see the results. You'll see the results in front of your eyes, where you have just heard what Asra said. I know we have so many clients which are there. You can go there and browse our YouTube channel. You can see a lot of interviews there with the different patients, and we have another interview coming up on Monday. We'll be releasing another client's video soon on Monday. Yeah, so initial 1 week is definitely, all you have to do is fight with your vices, fight with your habits, and then after that, it's quite easy, because you love that after that, because you'll start feeling fantastic, you'll start sleeping on time, because all these issues are there. Why? Because all these issues, majorly because of your metabolic issues. It is all bodies inflamed. You're not able to sleep properly. Understand? Yes, thank you so much. Yeah, it will help you, because the food plays such an important role. People have to know this. Food is most powerful than any other thing. I'm not denying surgeries. I'm not doing gynecology and obstetrics. I'm not doing an A&Es here, because I myself, my life was saved thanks to NHS, thanks to A&E, NHS and doctors, and they did so fast on me. The things, they even within 8 hours of my heart attack, within 8 hours they implanted me with the stents at the same time. They all perfect happened to me. My life was saved to this because of conventional medicine, because of modern medicine, which I'm also doctor, belongs to the conventional medicine also. But I denied to accept to the fact that I will be hooked and cooked because of medications. Sorry, I deny that, because it's not. Then after that, we did research, and you see the results. We see a lot of results here at our platform, where we're helping a lot of people come out and reverse the metabolic issue. And the best thing is, at the end of the program, people get empowered in our program. Once they come to it, they get empowered. That's what you need to do. Get empowerment. First, understand the root causes. They'll understand the root causes when they come to a platform. They understand the difference between carbohydrates, proteins, and fats. Then they understand what is healthy fats. They understand what is the quantity of protein they should eat. Like as Dr. Namrata said, that what American Diabetic Association, that American Diabetic Association, just since 15 days they stopped talking about this. We have been talking about the split since almost a year since we started the company. ADA, American Diabetic Association, they changed the version just recently, just 15 days back. Till then, we have been promoting the same philosophy. Half vegetable, quarter plate of non-starchy carbs, then proteins, healthy fats. So this is what we have been promoting through our platform. Fine. So hopefully you all liked it. We'll be sending you that email, the recorded version of this. Hopefully we'll upload this on the YouTube channel at the same time. You guys can go and have a look if you like to have. So thank you so much. And I think we can say bye to each other, and we'll look again. Thank you, Sundus. We'll soon connect with another next webinar. We'll be doing a webinar on, hopefully again, injections, GLP-1 injections, how that is become another epidemic. It will create another epidemic of metabolic disorders. Trust me. You're going to see that people, when they're stopping this medication, either they become dependent, they have to live with the medication for life. They want to live that. If they're starting that, or if they're otherwise, yeah, food and mood will be another good topic. Yes, that's another things we can do that, because that I'll do that usually with autism and ADHD with Kausar, because he has his programs. He has connection with a lot of institutes and community center councils here in the UK. So through that, we do a lot of food and mood food and mood discussions. We talk about ADHD, we talk about autism, we talk about depression, how food can affect the depression also, how food can reverse depression, how food can reverse anxiety, because this all linked to gut. Serotonin, all receptors are linked to gut. So that's another topic, the great topics. We can do more discussion on that. Yes, we can do those topics at the same time. Thank you for your advice, Sundus. And thank you for your help and support, and thank you for joining us, everyone. Susaid, Fundus, Noreen, and everyone who joined this show. Thank you so much. Asraji, thank you so much for joining us. Shadab, thank you so much.
Thank you.
Thank you so much.
Ma'am,
And
thank you.
Madam, thank you very much.
Thank you very much.
थैंक यू असरफ दी, थैंक यू आने के लिए, बहुत बहुत शुक्रिया.
Take care, everyone. Bye-bye.
Okay.
Bye-bye.
Bye.